Good afternoon. My name is Adi, and I'm here today to talk about Elixir PX, improving patient experience by giving a voice to the unheard. Before getting started, I'd like to give a quick introduction to our team. My name is Adi, and I'm a senior majoring in computer science. My co-founder Abhinav graduated last year, majoring in computer science and math. We had previously worked on another startup in the hospitality industry. After COVID, we switched gears and started working on Elixir full-time. So what's the problem we're trying to solve? The patient experience, or PX, consists of any interaction between a patient and any service provided by the healthcare system. The patient experience manager, or PEM, is responsible for this patient satisfaction and engagement during each of these interactions. Each hospital has between 2 and 4 PEMs who need to manage all of these tasks for each patient. As you can imagine, it's really difficult for PEMs to address patient experience across the entire hospital for every doctor, nurse, administrator, and each of the thousands of patients walking through their doors every week. The only way for PEMs to evaluate their success is by getting feedback from their patients. Feedback is complicated as surveys and reviews are carried out by multiple third-party companies. PEMs then have to follow up on feedback, change policy, or try out different projects to improve patient satisfaction. As you can see, this is truly a daunting task, made even more important as over 30% of reimbursements are tied to patient care and quality. These problems propagate down to doctors and nurses who lack insight into the PX process, which is a major part of hospital compliance and their evaluation. This lack of transparency leads to an increasingly high level of stress, which contributes to a burnout rate of around 55% among doctors and nurses, manifesting in worse patient experiences. So what does Elixir do? Elixir PX helps hospitals and patient experience managers better target their patient experience goals by providing a workflow management platform, allowing them to connect all stakeholders, tighten the feedback loop, and stay on track with compliance regulations. So why is the problem worth solving? Primary care practices are less likely to refer patients to bad hospitals, and patients are less likely to repeat visiting, increasing acquisition costs by around $125 per patient. This could also cost the hospital 30% of their Medicare reimbursement, which costs them around $6.5 million a year. And finally, the high burnout rate suffered by nurses alone cost hospitals around $1.18 million. The market opportunity here is vast. There are over 6,000 hospitals in the US with over 900,000 beds. In terms of our initial client characteristics, we're focusing on hospitals and healthcare centers that compete on patient experience, which are primarily located in suburban and urban areas, catering to private insurance or out-of-pocket customers. That's over 5,000 hospitals in the US alone. In addition, the healthcare enterprise software industry is currently worth over $75 billion and is poised for massive growth. Due to the impact of the pandemic, American hospitals have been forced to rapidly digitize many of their existing processes and are open to trying new solutions. Additionally, the healthcare industry is in a position to grow due to the increasing elderly population of the US. So with over 85% of these hospitals lacking the sufficient resources to meaningfully address patient feedback, Elixir PX is the solution. So what does it look like? Elixir PX is a system that integrates all things patient experience into one place, including feedback from all sources, compliance metrics, current projects, and the people managing them. The entire organization can utilize dashboards, reports, and project tracking to dig deep into the root causes of patient dissatisfaction. When you first log into Elixir, you get a quick snapshot of how you're doing with your tasks and survey scores. The project tab shows a list of projects that are currently being undertaken. They can be created by the PEM or suggested by Elixir itself based on patient surveys or online data. Within a project, you can discuss it with your team, assign it to a single person or group of people, attach media, and so much more. You can track your success and progress within each project with direct patient feedback in the form of Press Ganey integrations or public online review data. So what does this mean? For patient experience managers, Elixir provides them a specialized tool to manage, collaborate, and iterate through their different projects, allowing them to easily benchmark themselves and stay on track. The rapid and easy communication allows them to overcome organizational inertia, which benefits doctors and nurses, offering clearer views into patient insights, giving them more transparency during their evaluations. Overall, by using Elixir, hospitals can increase referrals and reimbursements while decreasing staff burnout. Thanks for listening, and we'd love to talk to anyone who works in a hospital or healthcare center to show our product and get feedback. Over to Raphael from Imperium Analytics.